So now those who have come for this channel first time, I would like to request them that before going for psychosis video, you please refer to our CNS basics video. Otherwise you may face a difficulty to understand it. Okay, so psychosis is a disorder of CNS characterized by hyperactivity of dopamine in mesocortical, very important, the mesocortical and the mesolimbic area. This is very important fact of psychosis, the hyperactivity of dopamine in mesocortical or mesolimbic system, full stop. Symptoms may include false belief, that is delusion, okay, false belief, delusion, then and hearing voice, seeing things which are not existing, known as hallucination, okay, and other symptoms include incoherent speech, that's arise because of thought disturbance, okay, then sleeping problem, social withdrawal, lack of motivation. Now when you are talking about lack of motivation, we recently discussed in our smart class about depression. We are going to upload the video on depression and mania. So in depression, one of the symptoms is lack of motivation. So that's why you find that the psychosis is often associated with some other diseases. So when you have a mental illness characterized by continuous or relapsing episodes of psychosis, they are known as schizophrenia. Okay, so this is a thing where it is associated with many other diseases like panic disorder, anxiety, obsessive compulsive disease known as OCD, obsessive compulsive disease, then anxiety, depression. Then cause of psychosis, it can be bipolar disease. Bipolar disease again we'll be discussing in our mania and depression. When the depression and mania both swings together, okay, they are known as bipolar disease. Then cause include deprivation of sleep, if you are not sleeping properly for many months. Genetics or cannabis contain tetrahydrocannabinol, which is an active ingredient. If this is ingested by the adolescent time, by the individual for prolonged of period time, they may develop a psychosis. Now the pathophysiology of psychosis include first dopaminergic model, that is very important. Now what is that? Now when you are talking about the mesolimbic pathway, also called as reward pathway, so that is very important concept. Again I have already explained into the CNS basic video. Mesolimbic pathway known as reward pathway. The pathway connect ventral tegmental area, VTA, ventral tegmental area, in the midbrain to the ventral stratum, ventral stratum of the basal ganglia. Okay, please refer to our earlier video. And this basal ganglia in the forebrain, that particular region, it's connecting the ventral stratum. Ventral stratum include a very important nucleus known as nucleus accumbens, okay, which actually accumbens and olfactory tubercle, okay. This two area, if the dopamine releases from the mesolimbic pathway to the nucleus accumbens, it regulates reward and the feeling of pleasure. Okay, that's why you have some people who having a pleasure of having alcohol, okay, amphetamine. That's the reason that the drug abuse potential like cocaine, ganja, tetrahydrocannabinol, these all are because of they stimulate reward pathway via dopamine. Then you have a mesocortical pathway which connect ventral tegmental area to prefrontal cortex. Now you have one special pathway in brain known as tubo, which that pathway is not very significant, but for treatment it is very significant. Tuberoinfundibular pathway, infundibular pathway in the brain responsible for release of prolactin by dopamine. So dopamine is a prolactin releaser. That is very important fact. Okay, prolactin releaser. That's why if you block dopamine, or D2 antagonist if you give, which causes hyperprolactinemia in the body, that's why you have an antipsychotic drug, maximum are D2 antagonist. Okay, antipsychotic agents. Then second model is known as glutamate theory or glutamate model. Normally, L-glutamate is an excitatory neurotransmitter which act on the receptor NMDA and AMPA. Normally, when it acts on NMDA, it regulates cognition and alertness. AMPA, it regulates memory and learning. So, if L-glutamate level increases, it causes excitotoxicity, which is nothing but, it can desensitize AMPA, and that can lead to the, disease dementia. That's why you have, the drugs which can recorrect the sensitivity of AMPA. They are known as nootropic agent. Pyracetam and iracetam. These are the drugs which is, again recorrect the conformational changes of AMPA. Now, normally NMDA is coupled with the iron magnesium. When L-glutamate acts for prolonged time, magnesium iron replaced, okay, and the calcium comes in a very vigorous manner, and that's the responsible that excitation happen for prolonged time. Now what happened in glutaminergic neuron? If NMD antagonist like phencyclidine, we have a drug NMD antagonist, phencyclidine, they can causes the cognitive problem, which can be another model for your psychosis, which also generate cognitive problem, generate the gamma waves in brain. Okay. Now the treatment, the most important treatment for antipsychotic medication is social support, and along with the active pharmaceutical ingredients, or you can say the drugs. Okay, along with the drugs. Normally, if you see that schizophrenia or psychosis is often combined with bipolar disease. So maximum time we combine some drug which can be to treat bipolar disease with mania and depression, plus the D2 antagonist, this combination. But the thing is now, that's why antipsychotic medication often combined with the mood stabilizer. Now the first is your typical antipsychotic agent. Now the typical antipsychotic agent, they block D2 receptor of both mesocortical mesolimbic area and as well as corpus stratum, which can responsible for the generating a side effect known as extrapyramidal side effect, Parkinson-like side effect. Okay, Parkinson-like side effect. So this is the first side effect, important side effect of the antipsychotic, typical antipsychotic drug. Now you have the phenothiazine nucleus derivative chlorpromazine